Atrial fibrillation is characterized by an irregular and frequently fast heartbeat. An arrhythmia is an abnormal cardiac rhythm. Heart blood clots can result from atrial fibrillation. Additionally, the illness raises the risk of heart failure. High blood pressure, coronary artery disease, and obesity are risk factors. Also, if atrial fibrillation is left untreated, it might result in a stroke and other heart-related complications. Commonly referred to as AF or atrial fibrillation, can cause heart failure, blood clots, strokes, and other heart-related problems. By 2030, more than 12 million people are expected to develop atrial fibrillation. So, have you ever had a rapid heartbeat and felt as though you were running out of breath? Here are some comments from patients regarding their experiences. My heart skips beats, flips flops, and feels like it's slamming against my chest wall, especially when I bend over or carry something up my stairs. There are a lot of unanswered questions regarding atrial fibrillation or atrial fibrillation. Watch the video to get all the information, so let's get started. How frequent is atrial fibrillation? Atrial fibrillation has been dubbed the new cardiovascular disease epidemic of the 21st century by some academics. Atrial fibrillation is very prevalent in the elderly. Globally, more than 33 million adults over the age of 55 have received a diagnosis. By 2030, an estimated 12 million Americans will suffer from atrial fibrillation. About 500,000 hospital admissions due to atrial fibrillation occur in the United States each year, and the condition is becoming increasingly fatal. Signs and symptoms. What happens when an irregular heartbeat occurs? Atrial fibrillation includes palpitations or sensations similar to a rapid fluttering or hammering heartbeat, ache in the chest, lightheadedness, weary, dizziness, decreased capacity for physical activity, breathlessness, weakness. Atrial fibrillation patients can have no symptoms at all. Ventricular fibrillation might be sometimes known as paroxysmal atrial fibrillation. IVF symptoms are sporadic. Usually the symptoms subside within a few minutes or hours. Some patients have symptoms for up to 7 days. The incidents may recur often. The symptoms may go away by themselves. Others require therapy for sporadic atrial fibrillation. Tenacious. There is a persistent, erratic heartbeat. Heart rhythms don't automatically return to normal. Medical intervention is required to rectify the cardiac rhythm if symptoms appear. Persistent for a long time. This kind of atrial fibrillation is a persistent condition that lasts more than a year. The abnormal heartbeat has to be fixed with medication or surgery. Unchangeable. The erratic cardiac rhythm in this kind of atrial fibrillation cannot be corrected. Blood clot prevention and heart rate regulation require medication. Before we continue, if you're enjoying this video, don't forget to hit that like button and subscribe to the channel. It really helps us and lets us know what kind of content you want to see more of. Causes of atrial fibrillation. Atrial fibrillation. Gaining knowledge about the normal heartbeat might help in determining the underlying causes of atrial fibrillation. Atrial fibrillation. Let's explore our hearts together. 4 chambers make up the heart. The atria are the 2 upper chambers. The ventricles are the 2 bottom chambers. The sinus node is a collection of cells located inside the upper chamber of the right heart. The impulses that initiate each heartbeat are produced by the sinus node. The signals go via the upper chambers of the heart. Subsequently, the impulses reach the AV node, a collection of cells, where they typically slow down. The lower heart chambers get the messages after that. In a healthy heart, this sequence of signals usually happens without any problems. At rest, the average heart rate falls between 60 and 100 beats per minute. However, when atrial fibrillation happens, the signals in the heart's upper chambers get jumbled. This causes the upper chambers to tremble or tremor. Signals attempting to reach the lower cardiac chambers flood the AV node. This results in an erratic and rapid heartbeat. The heart rate of individuals with atrial fibrillation might vary from 100 to 175 beats per minute. Atrial fibrillation. Atrial fibrillation is most commonly caused by structural issues with the heart. Heart conditions and other issues that might result in atrial fibrillation include an underlying cardiac condition known as a congenital heart defect, Ill sinus syndrome, an issue with the heart's natural pacemaker. An illness known as obstructive sleep apnea. Heart attack. Heart valve dysfunction. Elevated blood pressure. Lung conditions such as pneumonia. Coronary artery disease is characterized by narrowed or blocked arteries. Thyroid conditions like hyperthyroidism. Viral infections. Atrial fibrillation can also be brought on by heart surgery or stress brought on by illness or surgery. There are some atrial fibrillation sufferers who do not have any established cardiac conditions. Some lifestyle choices that may set off an episode of atrial fibrillation include overindulging in coffee or alcohol, drug usage that is prohibited, using or smoking tobacco, using stimulant-containing medications such as over-the-counter cold and allergy remedies. Diagnosis and examination. So, how is a diagnosis of atrial fibrillation made? Your healthcare professional will initially ask you a series of questions in order to diagnose atrial fibrillation. You'll share details about your physical and dietary habits, medical history, any symptoms you've experienced, and risk factors. Even if you don't have all the answers, please nonetheless contribute as much as you can. Your expertise and experience are vital resources for your physician to use when diagnosing you. After that, your doctor will examine you physically, doing the following: using a stethoscope to listen to the beat of your heart, doing a blood pressure and pulse check, determining your thyroid size to diagnose thyroid issues, checking for signs of heart failure such as swelling in your legs or feet, using your lungs' auditory senses to identify infections or cardiac problems. Your physician will have a better understanding of your physical state and overall health during this examination. Diagnostic procedures for atrial fibrillation. To diagnose atrial fibrillation, your doctor can do certain tests in addition to the physical examination. Among these tests are electrocardiogram, or ECG stands for electrocardiogram. Usually, the initial test is an electrocardiogram. It takes around 3 minutes and is painless. It enables your physician to determine whether your heart is beating regularly by measuring and recording the electrical impulses coming from your heart. Echocardiography, or echo. An echo displays the movement of your heart using ultrasonography technology. It may indicate issues with cardiac muscle contractions and blood flow. Blood examinations. An irregularity in our blood might occasionally result in atrial fibrillation. Easy blood tests can help your doctor choose the optimum medications for you depending on your kidney and liver function, as well as your potassium and thyroid hormone levels. Sometimes your doctor might wish to examine you to see how your heart functions on a daily basis. If so, you will be required to wear either a portable event monitor for up to 1 month or a Holter monitor for 1 or 2 days to record the activity of your heart. Treatment and medical interventions. What atrial fibrillation therapies are available? The primary objectives of treating atrial fibrillation consist of managing your heart rate, returning the heart's rhythm to normal, lowering your chance of suffering a stroke. Your doctor will probably start by prescribing medicine based on your symptoms to see whether it helps. Drugs. Atrial fibrillation medications may consist of the following. 1. Drugs that regulate heart rate to stop the ventricles from pumping too quickly. Diltiazem, digoxin, metoprolol, and verapamil are a few examples. 2. Drugs that regulate heart rate to support a healthy sinus rhythm in the heart. Procainamide, disopyramide, propafenone, sotalol, dofetilide, flecainide acetate, and amiodarone are a few examples. 3. Anticoagulant drugs or blood thinners lower the risk of stroke and blood clots. Aspirin, warfarin substitutes, and warfarin are a few examples. Side effects are possible with all drugs. Medication for rate control and rhythm control may affect your liver, lungs, or other organs, or they may exacerbate your arrhythmia. Blood thinners may result in hemorrhage, heart attack, or dyspepsia. The advantages of taking these drugs typically exceed the potential drawbacks. It's critical to go over all dangers and adverse effects. You could require a treatment or surgery if taking medicine doesn't improve your atrial fibrillation. Using low-energy shocks, electrical cardioversion electronically resets your heart rhythm. However, this may only be a temporary fix. Catheters are used in pulmonary vein ablation to supply energy around and outside of your pulmonary veins. Your body reacts more favorably to your atrial fibrillation medicines after this surgery. You might not even require long-term medicine. If your heartbeat is sluggish, you might need to have a permanent pacemaker installed. It is often reserved for cases where an arrhythmia other than atrial fibrillation coexists. One surgery that lowers your risk of blood clots and stroke is left atrial appendage closure. Scar tissue produced by the MAZ operation aids in the proper direction of your heart's electrical impulses. This process has a high rate of achievement. Your healthcare practitioner can suggest this alternative if you have a history of blood clots or strokes along with severe atrial fibrillation symptoms. There are several non-invasive techniques available, and new technology and therapeutic approaches are always being developed. Discuss your best selections and your possibilities with your provider. A complicated cardiac illness that might appear frightening, perplexing, or overpowering is atrial fibrillation. You're not alone if you think you may have atrial fibrillation, were just diagnosed, or have had the condition for years. Like millions of others, you're picking up new techniques for living a fulfilling life with arrhythmia. It's crucial to discuss these reasons with your healthcare physician and find out more about the support networks and services that are out there. Finding out the advantages and disadvantages of various treatment choices is also beneficial. Every treatment, including medicine, has some risk. But in order to protect your heart and lower your risk of suffering a stroke, therapy for atrial fibrillation is crucial. Your supplier will collaborate with you to select the finest approach. You may live a long and healthy life with atrial fibrillation if you receive treatment, follow up, and make lifestyle adjustments. Share with us your experiences and opinions in the comments below. Thanks for watching.